Bismillahirrahmanirrahim. Assalamu alaikum, everyone. This is Farah Hassan from Muslim American Youth Initiative. We are starting a series on Zoom session series on on mental health and well-being. And today is our very first session. Our topic for today is the importance and significance of mental health um, in our lives, and also we'll talk about the stigma which is strongly associated with it. Our goal is to create awareness through psychoeducational sessions and also help break down the barriers that impede access to treatment, therapy, and healing. So I'll go right ahead and introduce my co-panelists, Dr. Usman Athar and Mustafa Hassan. And I'll invite Dr. Athar to introduce himself to the audience, followed by Mustafa. So Dr. Athar.
Assalamu alaikum, everyone. Like Dr. Hassan said, I'm Usman Athar. I'm a recent graduate of psychiatric education. So sorry, give me 1 second. I apologize. So I started my career in Houston in residency or postgraduate training. And then I did a year of fellowship in New Orleans in psychiatric disorders and medically ill people. And now I'm in Jackson, Mississippi, where I'm practicing as an assistant professor at the University of Mississippi. I'm excited for the talk.
Wonderful. So Mustafa, if you can give us a brief introduction as well.
Assalamualaikum, everyone. So my name is Mustafa Hassan, and I'm a fourth-year medical student at University of Queensland, Oshner in Louisiana, and I'm currently pursuing a residency for psychiatry.
Wonderful. So we'll dive right into the questions because, we all feel there is a need to talk about mental health and to create more awareness, have some candid, open discussions to make the, all the material regarding mental health available to everyone who is listening. And we can contribute in, breaking down these barriers that impede the access to the treatment. So I would like to ask this question that what do you feel is the significance of mental health, why it's important to talk about it, and how it affects our life? Starting with Dr. Athar, I'll ask you first.
So mental health is everywhere. We don't really realize it because it's hard to identify and it's not easily discerned when someone is mentally ill versus mental health because we don't have blood tests. Say, for example, you go to the doctor and you have a diabetes checkup. So the doctor may ask you, I need a blood test to see what your hemoglobin A1C is, which is a measure of how much sugar you have in your blood. As a psychiatrist, I don't have anything like that to tell me, like a blood test or a scan to say someone is mentally ill or someone is mentally well. It's difficult to discern, but it's very important because we know that if someone is mentally ill, it puts them at more risk of death, suicide, of shortened lifespan, and even other physical illnesses, just like I mentioned, like diabetes, hypertension, and other illnesses like obesity, smoking, drug abuse, every type of substance abuse, alcohol use. So like Dr. Hassan is showing here, it's important to look at the World Health Organization definition of mental health as the foundation for the well-being and effective functioning of individuals. Generally speaking, people who are mentally healthy are able to thrive in their relationships, in their workplace, in their family. They have a positive attitude towards life, and they're able to contribute to the greater society very effectively. And if people cannot do that, then it's a burden not just on the person, but on society in general. And so it's a very important issue to talk about.
Yes, so it seems like because it affects so many aspects of our life, it is very important to discuss it to lead a healthy and a functional life. So Mustafa, you want to contribute something to this discussion of mental health and its importance?
Yeah, if you even go back to the previous slide for a second, I think that culturally we're moving towards understanding mental health, not only in ourselves, but just what it means to be well mentally. and how it actually contributes to our well-being, and it is a part of our well-being. And even like right now, how we've written it down, mental health and our well-being, we've separated the two. And I think culturally we're starting to realize that mental health is a part of our well-being, and our well-being is kind of going to be the overlap over which mental health will be under that, not two separate umbrellas. I think that's really important, um, on why we should understand what mental health really is and how it affects us downstream in our lives.
Yes. So that's a very good point that mental health and well-being should not be separated. They are so closely linked together. Um, Anything else that Dr. Athar, you or Mustafa would like to add, and then we can move on to the incidence of mental illness because this is again very important. We talk about cancer, like you said, Dr. Athar was mentioning that we don't do any lab tests, and so kind of the emotional thing just remains in undercovers, and we don't understand how important it is to for the holistic well-being of a person. So the cancer, it seemed, I was looking at the, Americans Medical Association and Psychology Association, and they were comparing that cancer, its incidence is 1 in 23. Cardiac problems is 1 in 14. But look at the mental illness, it is 1 in 5. So I know that you work in that field and you have firsthand experience. So if you would like to tell us that how frequently you see and the severity, because the symptoms and the severity also goes from moderate to severe. So if you can contribute on the incidence of mental illness and how we can pick up when someone is starting to have something so that they can seek therapy or treatment.
Absolutely. Yeah. So just as a clarification, the word incidence means in medical education that someone newly diagnosed with a condition. So the incidence of mental illness, meaning that nearly 1 in 5 American adults will have a diagnosable mental health condition, meaning that 20% of people may go to a doctor in a certain year and be diagnosed with a mental illness. So it's extremely common. And almost half of people in America in their lifetime will meet criteria for a mental illness. The most common condition that I see people in my clinic for is anxiety, and that's followed by depression. And there's also more severe mental illnesses like bipolar disorder and schizophrenia, which we can talk about in other sessions. So it's incredibly common, and I know that we're going to discuss stigma later, but it's surprising to me that even in the most developed country in the world, even though it's so common, people have so many misconceptions about what it is and how to treat it. And I think we're starting something really great in the Muslim community to educate people about these issues.
That's great. So, Mustafa, you want to add something to it, to the incident?
I'll just echo that through my rotations, I've seen that right now I'm in family practice. I've been going through the clinic, and I can see that almost every patient that we see in clinic for diabetes or hypertension is also suffering from a mental illness. And sometimes people are diagnosing them, sometimes we're not. Sometimes they're trying to take care of it in the primary care setting, and sometimes they're trying to send it out to psychiatry and sometimes even a therapist. And it's very prevalent and something that I didn't realize was so prevalent in society till you see other places trying to deal with it.
Yes. So there is one question that comes to my mind that, when we realize that we don't acknowledge sometimes, there is a mental illness or some issue going on and it's not acknowledged. And on the other side, a lot of people think that a lot of you can say um, mental health issues are overdiagnosed. So, what do you think? Do you feel that it is happening? I can start with Mustafa because he's in that environment where students are there and they can have from moderate to severe symptoms of anxiety and stress. So, do you think that they are kind of diagnosed, labeled, overdiagnosed, or you feel that it's still the issue is that it's not acknowledged much out of the two?
Um, I think I think there is a lot of stigma there. There's a lot of fear of kind of labeling everyone. You don't want to just diagnose someone with something and then they kind of act that way as well. So um, I think there's hesitancy still with labeling someone with a mental illness. Yeah.
Dr. Arthur, what about the overdiagnosis?
It depends on the condition. It's a deep question that you asked, a very important question. So there are certain conditions that I think are
I'm sorry.
overdiagnosed.
I'm just gonna ask everybody to please mute
Mute.
your videos.
Yes,
If
if you can.
you can please mute them.
Oh,
Thank you.
Yeah, so the question from Dr. Hassan was that overdiagnosis in mental illness. There are certain conditions that I think are overdiagnosed. There are certain conditions that I think are underdiagnosed. Conditions like adult ADHD tend to be overdiagnosed because a lot of people come to a psychiatrist seeking medication for ADHD in their 20s and 30s for reasons like, doing well in college, graduate school, their job, and they may not meet full criteria for ADHD or attention deficit hyperactivity disorder. There are other conditions which are probably underdiagnosed, like bipolar disorder. A lot of people feel that they're depressed, but they may actually be at risk of bipolar disorder. And that may have to do with stigma because generally speaking, bipolar disorder carries a much heavier stigma than depression does. So it just depends on the diagnosis. It's not a clear-cut answer.
yes, because I would like to carry on to the next one where if we can explain what mental illness is, and then we can distinguish between what is a normal sadness or normal stress and how it becomes, pathological that we need to seek therapy for it. So starting with, Dr. Athar again, I would like to, for him to explain a little bit what mental illness it affects. It seems like three aspects. So, or, how you feel. You can go on with that because we have
Sure.
illnesses as well. And you can, you're welcome to explore them and these aspects on this slide.
Yeah, absolutely. Thank you. So I think, if we come with the example of depression, which in psychiatry we call major depressive disorder, generally speaking, there's a difference between being sad and having major depressive disorder. And just like, this cartoon that's depicted here, major depressive disorder is when your thinking and feeling and behavior is affected to the extent that you have serious issues with life in general. And the one thing that I look out for with patients who suffer from this disease, which is incredibly common, is that the patient will start feeling like life is not worth living and may also have thoughts of hurting themselves. So there are some things that really separate normal mood changes from a mental illness, and those are things like wanting to hurt yourself, for example. So not that I would ever encourage anyone to diagnose themselves, but this is just for an understanding of things to look out for, warning signs or red flags. And then Dr. Hassan, you also wanted me to speak about causes of mental illness. Is that correct?
Yes. So
Yes.
because it's not
I'm
just,
sorry to interrupt.
yes, no, I was just going to say that there are different categories of, there are disorders, illness, there is psychological issues, emotional issues. So if you can just give us from the medical perspective, like what are the causes for mental illness?
Yeah, absolutely. So when I talk about causes of mental illness, I like to divide it into your body and your mind. So from a bodily perspective, like this is just an easy way to think about it, not to say that it's completely scientific, but from a body perspective, like there are genes and there are hormones which affect your mental well-being. So for example, a lot of women who give birth can experience depression after the birth because there's a significant hormonal change that happens in their body. From a genetic perspective, we know that if your parents suffer from depression, then it makes it much more likely that you'll have depression as well. And we also know that mental illness runs in families. So genes, just like there are genes for eye color, for hair color, for skin color, there's also genes that affect us in a negative way. And then hormones, are things that, regulate our cycle, regulate our eating, our growth, and these can also be affected in mental illness to cause mental illness. So, like, what I would like to speak about from a mental perspective is just like Dr. Hassan is saying, psychologically, sometimes, like what's written in the slide, early adverse experiences. So we know that people who suffer in childhood with things like abuse or trauma are much more predisposed to mental illness. And this can, include things that are very difficult, like physical abuse or sexual abuse, or even emotional abuse, and just being exposed to that over and over again. It makes it very difficult for many people to function well as adults mentally. So these two things are what I can talk about in a brief manner, but sometimes they both interact with each other. Say, for example, you have a parent who suffers from depression, and then you're born in an environment which is very abusive, and you suffer abuse for a number of years, then that predisposes you to mental illness much more than someone who doesn't have those two things.
Yeah.
So that's what I would say about that.
All right. Thank you. So Mustafa, you want to add something to this or this
I
slide?
think no, not really.
So I just wanted to explain a little bit this picture because most of the people don't understand that how our behaviors are formed, and sometimes when we are having certain thoughts because of all the causes that are here in the causes of mental illness, it can be because of biological factors or genetic factors, adverse experiences or substance abuse, anything. Then what happens is that our thinking process is affected, and how we think, how we perceive outside of us, the world outside, and perception of our own selves becomes distorted, and that then perpetuates certain feelings in us and how we handle different situation. And that's the emotional now distortion that's occurring within us. So cognitive, then emotional, and that manifests in our behavior. So what we see a violent person or a depressive person or a abusive person, how it manifests is it depends on the cognition and the emotional aspect of that person that has been formed due to whatever the reasons may be, due to the reasons jotted down here under mental illness. So this is, because it's important to understand certain behaviors that people have, and because we are coming to stigma, because immediately people are judging each other due to because how they feel, how they look, and how they think, how they emotionally respond to each other, and in their relationships and their interactions and their behavior. So we'll now come to the next one, which is next topic, which is the stigma, which is so associated with mental illness. And I would start with Mustafa, that if he can give us some kind of an idea, like why stigma associated with mental illness. What is it in mental illness that people discriminate and people are reluctant and hesitant to come forward, open up about their feelings and emotions?
Well, I have just some general thoughts on it. It's not very scientific, but I do believe that uh, different stigmas around mental health are seen in different groups. Like, say, the Desi culture,
Mhm.
they're a lot more tough on people who say there's something wrong with them mentally. They'll shun them, kind of like exclude them from things. So they're much less likely to come out and say they're going to seek help, or actually even go out and seek help for their mental health. And that affects them negatively multiple times, like, in their life. Um, I think it's just the worldly perspective. There's just something broken about you if your mental health is messed up, but there's nothing wrong with you if your heart's messed up. It's just it's like a health condition, but mental health has not become a health condition yet.
Yeah. So So basically, this is a big thing because people perceive you as broken, weak, lazy, or something is defective in you. It's not that it's an illness which can be treated or which should need that people can access some kind of a treatment for that. So, any thoughts, Dr. Athar, on the stigma, if you would like to share with us?
Yeah, sure. I think a little bit like what I was talking about earlier. It's much easier to have stigma towards something that we don't understand well. And in terms of medical knowledge, both scientists and the lay public, we have a very poor understanding, unfortunately, still of mental illness. The exact causes, the people who are predisposed, what can happen, and that's why I'm very glad that we're doing this project together, because education is the key. If people are educated, then stigma generally goes away or is reduced. So I think stigma, it's a problem of misinformation. It's a problem of things looking mysterious, and that adds to it. And then just cultural barriers, just like what Mustafa was talking about. Certain cultures stigmatize mental health much more than others. And I think what's exciting in the West, at least for me, in my career, is that even in the past 10 years, things have changed drastically in the United States. There's much less stigma towards talking about mental health. There's much less stigma with people admitting that they have a mental illness. And, I would like the Muslim world to catch up to, inshallah.
Inshallah. And this is the whole purpose and our goal for these sessions, that we are able to educate and create awareness of mental illness. And sometimes, people come in therapy not just for because they have a certain illness. They come, and I'm talking about my own experience as a professional person, that they come because they realize that their relationships are being messed up because of a certain perspective that they hold, and they want to educate themselves or evolve. As therapy is not just for illnesses and all of that, but it is for your self evolution as well. You can come to therapy and have this conversation with a neutral person who can give you some insight to how to reach out within, like we say, that find your authentic self, which is very important to understand your authentic self so that your outside relationships and outward look can improve. So I would really like if Mustafa or Dr. Arthur, any one of you can talk a little bit about how stigmas are formed. Like we see that how it is, there are different types of stigma. So if you want to talk about it, because an individual can have a stigma of in their own perception for themselves as well. It's not just that it's coming from outside, it can be within the individual as well. So, and it's very important to understand, because sometimes people are not bombarded by judgments from outside, but they are judging themselves. And that is what hinders in their seeking for therapy. So if you can, any one of you can talk about stigma a little bit more.
I would like to tackle that, inshallah, but this diagram is beautiful. I think there's a couple of very important things that it focuses on. So I just wanted to give examples of each of them. So when we talk about structural stigma, we are really talking about the way that, structures like the government or industries stigmatize people with mental health. And I can give, some examples that I've seen throughout my career. For example, when you are applying for a license to practice as a physician, that license can be denied very easily if you have a mental illness, even something like depression. So, and a lot of people who are physicians actually hide the fact that they suffer with mental illness because they don't want their license to be revoked. So even in a country as advanced as this one, there are severe structural stigmas. And then, to think about Pakistan, my father is a physician, and he did his medical education in Hyderabad, Pakistan. And he told me that his experience with mental health education as a medical student was going to a very decrepit mental institution where the mentally ill were held in chains. So that's also a type of structural disparity with how people with mental illness are treated. the public stigma, what I think about is just how the media and entertainment and our families treat people with mental illness, how they are prevented from certain life goals like getting a job or marriage or friendships, how in the Desi community and also in the Arab community, almost every community, the African American community, people with mental illness are held back from fully experiencing and enjoying their life in several ways. And all these things interact together to create the self stigma with the individual. The individual is born into this environment and they tend to react, just like anyone else would, by inculcating or basically forming very negative ideas about themselves, which hold them back in really profound ways.
And yeah, so that, so many factors are working, within the individual and outside. And I think that here it's kind of, it comes to my mind that, especially when you're living in a society which is different from your own culture, and it's, you are an immigrant there, it's very important to have your own identity and be comfortable with your own identity, because it can give you, it can empower you actually to integrate in a better way in that society, because you have a better self perception. And that can, as soon as you have a better self perception, it improves your interactions with outside people as well. So, Musa, anything that you want to share with us regarding the stigmas that are there in the picture?
Well, I mean, I've seen people who kind of self stigmatize and then um, don't want to come out for help. And this is like, personally in my school, from the Desi communities, and versus, a more there was a Caucasian person suffering from the same thing, and they actually went out, got help, came back. They're a semester behind, but they're progressing in their medical career. Whereas in the Desi community, they were too afraid to do it. They actually didn't do well because they didn't seek help, and are about a year behind, and we're not very sure if they're going to join us back in our school. And it's just really sad to see that the difference between the two people was that one person seeked help because they were comfortable to do so, and the other people, they knew they needed help, but they were too afraid to do so, and kind of pushed through. And things obviously got tougher as the years progressed, and it did not get easier for them. So
Yeah, so it seems like the public stigma and the structural stigma are so strong that it actually, for the individual, like they think that, the self stigma actually becomes very strong. So, and definitely there is a fear of what people will think, and how wherever they work or it's their academic place, how they'll perceive them. So they'll be discriminated or they'll be judged or labeled. I think labeling is also another big factor of stigma. So moving on, so stigma has very harmful effects on people. So if I can start with Mustafa this time, that if he can give us some idea that uh, what can uh, what kind of effects a stigma can have over an individual who is trying to seek some
well,
treatment.
just continuing from the previous example, I think it's the same thing where
Mhm.
you can fall behind in life, and that can kind of perpetuate things. If you're depressed and you're not seeking help, or you're anxious, you're not seeking help, and then you fall behind, it's like a positive feedback loop, which makes you more anxious, more depressed, and possibly cause you to take actions that you will regret later on, all because of the stigma that something's wrong with you, and therefore you have to go seek help. um, and I think that's what the harmful effect really is. It's not the immediate, uh, obviously barring like the more major psychiatric illnesses, but the immediate effects are not as evident until they perpetuate and like kind of snowball into a much bigger point.
Definitely, and like this diagram is showing that individual who is trying to seek help can actually become a victim, and he can just stay there, like become complacent in his oppressive environment, and then there is obviously impediment in improving their lifestyle and functionality, which is a big thing. So, Dr. Athar, you want to shed some light on harmful effects of stigma?
Yeah, I think one of the saddest things that I've seen about stigma, from people that I know who suffer, is that they are being held back from experiencing life to the fullest.
Mhm.
Just being able to have clarity in their thought process, being able to look at life in a positive lens, just because the stigma that they have and people around them have prevents them from getting help. And it's just very tragic to me. I think it's, why live at 50%? Why not try for 100% in terms of your health? I know that all of us here, we would feel very comfortable if we had some type of, blood deficiency, like an iron deficiency, to go to a physician or someone and seek treatment, because medical illnesses, bodily illnesses, are much less stigmatized. So when I see someone that I know who's suffering in this manner, and they are in denial and their family is in denial, then it's very difficult.
Definitely. And, looking at this picture, I'm also, the big thing is that the insurance won't cover the treatment, can become a big hindrance as well. And this has been recently, I've been kind of thinking about it, because I see when the clients come in, um, self-pay mostly is not a very ideal thing for them. And sometimes, psychologists are not covered by insurances, so they can't take those clients. And self-pay is a problem. But on the other hand, in the aesthetics, people are paying enormous amount of money to get those Botox and fillers and improve their outward appearance, which has nothing to do with, I mean, it can do, you can say, something to their mental health, because you look pretty, and then you obviously you improve your self-esteem, but that's a debatable thing, like what are you basing your self-esteem on? But as far as the therapy is concerned, it's strange that, because therapy can actually get to the root cause of where your self-esteem is damaged or your confidence is damaged, and it can improve it. It can help you evolve. It can help you to become a better individual. But people are not ready to spend that money on these therapy sessions, or but as far as the self-pay is concerned, so they are quite reluctant. So I feel that this is another mindset that one has to look into, that what is it going on, and we should do something. That the insurance, I think now, because of the pandemic, now there is more awareness that people are seeking more and more mental help in their issues. So I feel that maybe now it can get a better coverage from the insurances, and it becomes more accessible, the therapy and psychiatric treatment for individuals, hopefully. That's my opinion. So coming on to how can we make a change? So the stigma is there, and if we have to, as an individual and as a community, and especially if we consider a Desi community or community at large, what can we do that we can improve um, this stigma issue? Starting with Dr. Athar.
Yeah, I just wanted to say, I think before I get into this, your point about therapy was so important. It's such a beautiful thing. I think almost every patient that I see can benefit also from psychotherapy, and it's very underutilized, and we really need to think about this. So according to this model, what we're doing right now, it's basically just awareness. So we're taking baby steps, in our community, the Desi community, the Muslim community in Houston or abroad.
Mm-hmm.
That's just the first step, and then hopefully, it leads to a downward, cycle effect where we can accomplish the rest of this, step by step, very, gradually. So it's a process. Like I mentioned before, this first step is really education, self-education, community education, more awareness for physicians, for psychologists, for psychotherapists, for the lay public about these issues, because even people in my field, like psychiatrists, we have stigmas that we deal with. And this is something that I really have to educate myself about and be self aware. So that self awareness and community awareness will lead to the demystifying the disorders that we deal with, and leads to things like understanding, normalization, acceptance, inclusion, support. What's interesting to me also is that, this is both like an individual model of change, but also, like it says, a societal model. And one of the things that we really need in mental health education and awareness is money. So from a governmental level, to advocate for the mentally ill, to advocate for better resources, for more being spent, because we are currently in a mental illness epidemic. We're not just in a COVID pandemic. We have a massive problem, and we need to tackle it. So that's what I would say about societal change.
Yeah, definitely. And these are all very important points. And, we do need funding from the government to create more awareness and to make this accessible to everyone. And starting from awareness, I think everything falls in its place. When we create awareness, we are educating and people are understanding. There is more acceptance of the fact that this is, and, these are maybe illnesses or mental health issues, and people don't feel there is a lot of shame and guilt associated with coming forward and talking about their mental health issues, and that impedes their well-being, definitely. um, I have this slide here, that 5 ways to end mental health stigma. It's right here what Dr. Athar was saying, that educate yourself and your children. I think starting early on is a great idea, that children should know that there are certain situations and it should be made, it should be normalized, and share real life experiences. Sharing stories, I am a staunch believer that our stories connect us, because being human, we all have some experiences that are shared experiences, and talking about them kind of gives each other comfort, that we all go through certain situations. No one is immune to it. So everyone goes through something or the other, experiences, sadness, depression, grief, all those sorts of things, sometimes communication issues in relationships. So we can normalize it and not make it such a big thing that, we feel ashamed of it, that something is not right in us, it's defective. And explain mental health, it's very important, the third one, that the range of symptoms. So it's not like, okay, that person has to be crazy to go to therapy or treatment, but there can be like something that is just starting. Maybe one day that person is not feeling very positive, doesn't have a positive outlook on life, or so the symptoms can be from moderate to severe. So they are not like, people think, oh, that somebody is seeking therapy, that person has to be, like on the edge in crisis, or just going over the edge or something. Listen and support others. It's very important, because I've seen that when my clients come to me, they always talk about this thing, that they tried approaching their family members, which is obviously not a very good thing to do. But for, I mean, just an individual, if he or she is going through something, the first thing is to reach out to the loved ones, family members or close friends, but they don't get that kind of a response where it's very therapeutic or supportive. So I would suggest that always seek professional help, because there's a neutral person who will look at the things from a third person perspective, and give a more non-biased opinion, and would obviously give guidance accordingly. But the family has already, they are there in the relationship, so it's hard to have a non-biased opinion. Share stories of overcoming it, mental health disorders. This is again very, very important, because talking about success stories, not end of the world. Somebody can actually be suicidal, but just to make them comfortable and tell them that they can get over it, they can get past it, they can process their feelings and emotions, go through all the stages of therapy, and then tell them the success stories, that people, normalize their life, they get back, they
क्या कह रही हो ये
and
लो
become
सुनो
functional. So I think someone's mic was on, so if they can please mute themselves. So I think we covered most of it, and this is basically our last slide because we were talking about all these factors today. We talked about stigma, but we are talking about our goal, which is to break down the barriers that can hinder access to the treatment. So stigma is the biggest one, and then there are so many others. There, people they don't have the understanding of the problem, so they need to be educated. They believe it won't help. So this is a very common thing as well, that people feel that, okay, therapy might not help, it's just a conversation, but it's not. There are specific treatments that are used, interventions that are used for different mental health issues. So I'll stop here so that we can give our audience some time for questions. I think there was one question in our chat. And the question is that, do you guys feel that mental health issues have been increasing as we have become a more developed society, that is increase of social media, changes in work life, social life, etc., or is that we have become more aware of mental health in general? So who would like to answer that question?
I think it's both. The example that I can give you, we are more aware of childhood developmental disorders like autism now. So we are better at diagnosing it. Like, in the past, when my parents were growing up or my grandparents, there would just be an understanding that, this child is not normal, and that was it. But now we know that there are different types of developmental disorders, which are types of mental illness. But I don't think we can deny that the way that we live right now is impacting how we feel, and it's leading to an increase in mental illness. And I don't think that we can deny that there's a role for social media, the way that we're using it right now. I mean, social media is a tool. It's not good and bad in itself. There are many good things that you can do with social media. There are many bad things. But I'm talking about, things like cyberbullying, things like, keeping up with the Joneses on social media, fear of missing out, and then, a highlight reel, not being honest or authentic on social media for whatever reason. So these things, we need to think about in it. And, there's other things too that are leading to people being stressed and worried and anxious, besides just the pandemic. The fact that most young people who are younger than me or my age, we are in debt from our education. The fact that most of us cannot afford things that we used to be able to afford. The fact that, climate change is happening. The fact that there's endless wars in the Middle East. So there's just a lot going on in the world. And we're hyper connected, and we're aware of these issues like we never have been before. We know from a psychiatric perspective that people have never been abusing drugs at this level, and the rate of suicide is also increasing in society. So this is something that we think about and talk about.
Yes, definitely. And I think that's a great point. I think we should have a separate session for social media and on that, and also on suicide, inshallah, soon. Mustafa, you would like to add anything to this question?
No, I just echo that I think it's both. We are more aware of so many more problems that are going on in the world, that I think there is an increase in mental health issues, but we're also much more educated than we were, say, 10 years ago, in saying that something's wrong. And I think it's my mental health that's wrong. And I think the next step would be us creating the infrastructure to provide the help that people need and not be bottlenecked. And I'm like hopeful towards that. Yeah.
Yes, for sure. And then we have another question. How do you guys feel about working on mental health even when there is not a stress in your life, that is life coaches? Do you feel as if people take therapy for just focusing and life goals? And I'll ask you, Mustafa, if you can answer that one. You can, you want me to repeat it or?
Oh, I'm not very sure, honestly. I think Dr. Out there or yourself would probably be better at answering that question.
I think that in general, I would say that almost anybody can benefit from psychotherapy. When I was going through my psychiatric education and learning about psychotherapy, I learned so much about myself, about my thought processes, about the defense mechanisms I use to deal with life. And I'm very grateful for that education. So it's not that everybody is just has to run to see a therapist right now, but reading about these things and learning about these things, even when you feel well, I think it will only benefit you. It's just like when everybody, like we have a fad to do yoga, to do marathons, to exercise, and these are all very good things for your body. So the same way, there are things like mental hygiene, being grateful, having a gratitude journal, or examining your thoughts, mindfulness in general, which is things that I think we should address in future sessions. But I've had plenty of clients who are like, I just want to check in, and I'm like, that's totally okay. I think you're doing fine, and here are some things that you can look at if you want to work on it more.
Yes, and I think that's a great point. And I would just like to say, yes, we do need life coaches and all of that, and especially in the pandemic times, I've seen that spiritual. It's not just the we are now mental health issues have increased, of course, but then it's not just people seeking cognitive behavior therapy or something just to eliminate their symptoms or get over their symptoms, but now people are becoming a lot of people are having this spirituality is coming out because now what has happened is that they are reassessing their priorities. They are thinking in solitude. They are more self-reflecting about their own self, about their thinking, and also there are so many factors that they are finding higher purpose. A lot of people have formed different organizations to reach out to the community to help. So these are all spiritual factors which we were kind of not thinking that much in our daily life before the pandemic when we were running from one thing to the other. So yes, we will definitely would like to have and one full session on spirituality and how it can help in mental illnesses. Um, there is one more question. Um, do you think it's a good idea to take young children for a mental health checkup, like a yearly physical? Should that become part of the healthcare system?
I think if you don't mind me answering, I think that would be amazing if we actually had the resources, like the number of child psychiatrists and psychologists to be able to do that.
Mhm.
Unfortunately, if that was a reality, then I think all of us who are in mental health would be working 24 hours a day, 7 days a week. So we're just not there yet in terms of providing those types of resources, but it's a beautiful idea.
Yeah.
Um, and I think there's someone who would want to answer that question as well.
Yeah, I think it's I have seen it firsthand because my office is in the same building as my husband, who's a pediatrician, and it's amazing. It's so mind-boggling that so many young children are coming who, when we do a initial assessment of depression, they are very depressed actually, and it is getting worse. So it used to be like a little bit more moderate or something. It's becoming severe with suicidal intentions, and the ages are 6, 7, 8 year old. So this is getting very high risk kind of a factor. So I think we definitely, if the resources are available, we should be able to do that. Then that would be a great thing to do. So we are actually at the very end of our session. I would one more time invite everyone who is there. If they have questions, they can unmute and ask a question, um, because it's time for us to wrap up then.
Assalamu alaikum. Again, I just wanted to touch up a little bit on the question that one of the attendees asked about mental health in children. I work as a pediatrician, and I just want to let you guys know that it's part of the American Academy of Pediatrics guideline that we are screening all moms and dads for the first 2 months after they have their newborn for depression. And then Academy also recommends doing depression screening on children starting at the age of 12 years and on. So it's part of the regular routine newborn care. So, and pediatricians just being the watchdogs for the young guys here, that if it is not being done, then they're not doing justice to uh, whatever they are trying to do as pediatricians. So yes, there's a screening tool that we run on the children and also on the parents to screen for postpartum depression and early childhood depression in children. And the one more thing that I want to comment on is that as young parents and parents of our children, what I my experience is that a lot of time things are pushed under the rug, and we kind of say, okay, this is all right. He's going to overcome this, or she's going to overcome this. Please be very, very mindful when you notice those changes in your children and you feel like they are not doing what they're supposed to do. Pay very special attention to that. Either help them yourself or seek help, because it's really, really important. And children, generally speaking, um, are not very forthcoming in trying to tell how they are feeling about things, because they do worry about the fact that they might be causing more anxiety in the parents by bringing on something that they might feel will bother them. So um, that is my comment, just as a pediatrician and as a father, that it's really, really important that you pay attention to the changes, um, uh, talk to them as friends, and I think it really, really helps.
Thank you so much, Hassan. And just to wrap this up, since we brought up pediatrics and the newborn and everything, I would say that postpartum depression is very real. And a lot of mothers are very much pressurized that they've become new moms and they should feel in a certain way and be very elated and excited about the baby. And sometimes they're not feeling that way and they kind of suppress their depressive emotions or whatever is going on in their head. They need to give, I think that they need to come forward, and it should be made accessible to them, the treatment, and they can talk openly about it, because postpartum depression is very, very much prevalent, and it's very real. It's not a myth, and they should not be stigmatized for not feeling the way a mother should feel when she has a child. So I think if we don't have any more questions, then we can wrap it up. And I would like to thank everyone who attended. And thank you so much, Dr. Athar. Thank you so much, Mustafa. I know you guys are very, very busy for taking time out for this. And also, I would like to thank both of you for forming this team, because, I really needed people with the same passion and same mindset, so that we can make a difference, even though it may be a very small, minute, but we are making an attempt and effort. And thank you everyone for attending. And inshallah, we are planning to hold one session per month, and we will be bringing to you new topic for the next month very soon. Please don't forget to give us your feedback, and also you can suggest topics that you want us to cover. That would be hugely helpful for all of us. So thank you everyone. Stay safe, enjoy your time, and take care of yourself and your families. Okay, Khudafis.